Welcome to our comprehensive lesson on nail health. Today, we'll explore the structure of the nail, how it grows, and how to recognize various nail diseases, disorders, and conditions. Understanding these aspects is crucial for anyone providing nail services, especially when clients face challenges with their nails. By the end of this lesson, you'll be equipped to identify nail parts, explain nail growth, and recognize common nail issues. Let's begin by considering what you think is the most important part of the nail and why knowing this matters for safe and effective client care. Following this lesson, you'll gain the ability to identify the parts of the nail, explain how the nail grows, and recognize nail diseases, disorders, and conditions. These skills are essential for barbers and nail technicians, enabling you to meet clients' needs and provide helpful treatments. We'll also cover examples of nail conditions and discuss how to modify services based on what you observe during nail and skin evaluations. Let's dive into the details and build a strong foundation for nail care expertise. The nail is actually an appendage of the skin. Its technical term is onyx, and the study of its structure and growth is called onychology. Understanding these terms helps you communicate professionally and accurately with clients and colleagues. Nails play a vital role in protecting the tips of our fingers and toes and are closely linked to overall skin health. Let's look deeper into the anatomy and terminology associated with nails. Let's break down the main parts of the nail. The hyponychium is the living tissue underneath the free edge, while the free edge itself protects the tips of fingers and toes. The perionychium covers the sides of the nail plate, and the nail plate is the visible area from root to free edge. Sidewalls are folds of skin on either side, and nail grooves are tracks the nail moves on as it grows. The nail bed is where the nail body rests, supplied with nerves and blood vessels for nourishment. Understanding these parts helps you assess nail health and provide targeted care. Beyond the basic parts, nails have several other important structures. The lunula is the half-moon shape at the base, visible as a lighter area. The eponychium is live tissue at the base, while the cuticle is overlapping dead tissue providing infection protection. The nail root attaches to the matrix, which generates cells that harden into the nail plate. The mantle is a pocket-like structure holding the root and matrix. Knowing these structures is key to understanding nail growth and health. Nails are made up of hard keratin, similar to hair. Nail growth originates in the matrix, which contains lymph, blood vessels, and nerves. Cells are created and pushed outward from the nail root, and as they keratinize or harden, they form the nail plate. The rate of cell production in the matrix determines the thickness or thinness of the nail plate. This process is essential for understanding how nails grow and why they may change in appearance or texture. The average fingernail growth rate for adults is about inch, or 0.3 cm per month. It takes 4-6 months for a new fingernail to grow and 12-18 months for a new toenail. Injuries to the nail can result in shape distortion or discoloration, and permanent distortions may occur if the nail plate, bed, or matrix is injured or lost due to trauma or disease. For example, dropping a heavy item on your toe can cause the toenail to fall off and regrow with a different shape. Onychosis refers to any disease, disorder, or condition of the nail. The etiology or cause can be systemic, environmental, or disease-related. Understanding the root causes of nail issues is vital for proper diagnosis and treatment. By identifying these factors, you can better support clients and recommend appropriate care or referrals when necessary. Before performing any nail service, it's important to examine the skin and nails to determine if the client can safely receive the requested service. The 6 signs of infection are pain, swelling, redness, local fever, heat, throbbing, and pus. Recognizing these signs early helps prevent complications and ensures clients receive the best care possible. Examining the skin and nails involves checking temperature, texture, inflammation, color, and condition. Cold hands may indicate poor circulation, while hot skin suggests infection. Texture and redness can signal disease or disorder. The color and condition of the nail bed may reveal injuries, disease, or poor circulation. The length and condition of the free edge can indicate nail biting or dryness, and the shape and thickness of the nail plate may point to underlying issues. If any indicators of nail disease are observed, it's essential to refer the client to a physician. Nail diseases covered in this lesson include onychomycosis, tinea manis, tinea pedis, paronychia, onychoptosis, onychia, onychotrophia, and onycholysis. Early referral ensures clients receive proper medical attention and prevents further complications. Onychomycosis, also known as tinea unguium, is a fungal infection where the nail becomes thick and discolors, ranging from black to brown or beige to white. White scaly patches and yellow streaks may develop under the nail plate, and the nail may become deformed and fall off. This condition must be diagnosed and treated by a physician, and no nail service should be performed until medical care is received. Tinea manis appears as rings containing tiny blisters, usually dark pink to reddish in color, and may have dry flakes. It can be confused with eczema or contact dermatitis and may spread to nails, scalp, feet, or body. Like other fungal infections, it must be diagnosed and treated by a physician, and no nail service should be performed until cleared. Tinea pedis, commonly known as athlete's foot, causes itching and peeling of the skin on the feet. Blisters containing colorless fluid may form in groups or singly between the toes, leaving sore or itchy skin. This condition must be diagnosed and treated by a physician, and no nail service should be performed until the infection is resolved. Paronychia, or felon, is characterized by redness, swelling, soreness, and warmth to the touch. The nail may be lost and healing can take up to 4 weeks. The nail may grow out deformed but can recover its shape over time. This condition must be diagnosed and treated by a physician, and no nail service should be performed during the healing process. Onychoptosis involves the loss of nails, which may regrow if the underlying disease is cured. It often affects only 1 or 2 nails, and the nail bed will be sensitive and should be protected while the nail regrows. No service should be performed on the affected area, and clients should be referred to a physician for proper care. Onychia is an inflammation of the nail matrix, often accompanied by pus formation, redness, swelling, and tenderness. The nail may stop growing and detach from the nail bed, and it may not grow back or may be deformed if it does. This condition must be diagnosed and treated by a physician, and no nail service should be performed until recovery. Onychotrophia is characterized by shrinking of the nail, which may separate from the nail bed. If the matrix is damaged due to illness, improvement may not occur. However, nails may improve within 3–6 months if the matrix recovers. No service should be performed on the affected nail, and clients should be referred to a physician for evaluation. Onycholysis is the loosening of the nail plate, starting at the free edge and progressing toward the lunula. The nail does not come off completely but stays attached at the root area. This condition must be diagnosed and treated by a physician, and no nail service should be performed until medical clearance is obtained. Nail psoriasis leads to thick fingernails with pitting, ridges, and lifting away from the nail bed. It is not contagious, and if no infection is present, basic manicure or pedicure can be performed. Onychomates involve separation and shedding of nails, starting at the bottom. Nails become weak and brittle before falling off. If no infection is present, basic nail care is possible. Always check for signs of infection before proceeding. Pseudomonas aeruginosa causes greenish discoloration of nails, thriving in wet environments. No service should be performed, and clients must be referred to a physician. Pyogenic granuloma is a small, round, red lesion on the nail bed, causing severe inflammation. Again, no service should be performed on affected areas. Nail disorders such as blue nails, eggshell nails, corrugations, koilonychia, furrows, onychogryposis, onychocryptosis, melanonychia, and onychoxis can be managed with caution if no infection is present. Blue nails appear bluish in color, often due to poor circulation or underlying health issues. This condition is more common in older people and can be corrected if the cause is eliminated. Manicures can be performed with caution, ensuring no signs of infection are present. Always monitor for changes and advise clients to seek medical advice if symptoms persist. Eggshell nails are very thin and soft, almost transparent. They require gentle care and protection as they are prone to damage. Applying polish can help protect these fragile nails. Regular monitoring and gentle handling are key to maintaining nail health in clients with eggshell nails. Corrugations are horizontal wavy ridges across the nail, easily recognizable. If caused by injury, they may grow out and disappear, but systemic conditions can cause permanent ridges. Lightly buffing and applying a base coat can help smooth the nail surface and protect it from further damage. Koilonychia, or spoon nails, are nails with a concave shape. This unusual shape is unlikely to disappear and requires careful filing and polishing to protect the nail. Monitoring for underlying health issues is important, as spoon nails can be associated with systemic conditions. Furrows are indented vertical lines down the nail plate. They may grow out or be permanent depending on the cause. Lightly buffing and applying a base coat can help protect the nail and improve its appearance. Regular care and observation are important for clients with furrows. Onychogryposis, or claw nails, involves increased thickness and curving of the nail, often occurring with age or injury. Most commonly seen in the big toe, severely deformed nails may require removal by a physician. Cleaning under the free edge and careful filing can help manage this condition. Onychocryptosis, or ingrown nails, occurs when the nail grows into the edge of the nail groove, cutting the skin or becoming deeply embedded and infected. Tight shoes or improper filing can contribute to this problem. Soften the skin and trim the nail carefully and refer to a physician if infection or severe embedding occurs. Melanonychia is a brown or black darkening of the nail, resulting in darker bands that run the length of the nail. It occurs more commonly in people with deeper skin tones. Make clients aware of possible causes and suggest seeing a physician if the condition persists or worsens. Onychoxis, or hypertrophy, is the thickening of the nail plate or abnormal outgrowth of the nail. It is easily recognizable and likely to disappear with proper care. Lightly buffing the nail plate helps even out its surface and improves appearance. Pincer nails have increased crosswise curvature, pinching into surrounding tissue, also called trumpet nails. Treatment involves soaking and massaging the skin away from the curved nail. Plicatured nails have sides that angle sharply into the soft tissue, requiring careful rounding of the corners. Both conditions benefit from gentle care and at-home soaking and massage. Minor nail conditions are generally irregularities that require some modifications to the service. If any indicators are observed during hand and nail examination, services can be performed with adjustments. These conditions are not severe and can be managed with proper care and attention. Agnails or hangnails are split cuticles with loose skin partially separated from the cuticle. Skin breaks at the corners of nails and can be trimmed with nippers, healing in 2-3 days. Hangnails can be recurring, so regular moisturizing and gentle trimming are recommended. Bruised nails, also known as splinter hemorrhages, show dark purplish discoloration under the nail. Normal nail growth continues and the bruised area will grow out with the nail. Avoid applying pressure to the nail plate during care to prevent further injury. Leukonychia presents as white spots appearing in the nail, usually due to small separations from the nail bed. These spots grow out with the nail and normal nail services can be performed. Monitoring for changes and maintaining regular care is important. Pterygium is excess living skin that becomes attached to the nail plate, either at the eponychium or hyponychium. This disrupts normal nail growth and can be severe. No service may be performed on affected nails, and clients should be referred to a physician if the condition is severe. Bowes lines are indentations similar to horizontal corrugations that run across the nails. Nails usually return to normal after trauma, and regular nail services can be performed. Make clients aware of possible causes and monitor for persistent changes. Onychophagy, or bitten nails, is easily recognizable. If biting stops, nails will regrow, though they may be sensitive to touch and appear flat or deformed until fully regrown. Regular nail services can help encourage healthy growth and recovery. Onychorexis refers to split or brittle nails which are easily recognizable. File with an emery board carefully and soften nails well before trimming. Moisturizing treatments can help manage this condition, though it may be permanent in some cases. Throughout this lesson, check what you know questions help affirm your understanding of key points. Reviewing these questions ensures you grasp the essential concepts and are ready to apply them in practice. Take time to reflect on your knowledge and identify areas for further study. Let's continue with knowledge review questions to reinforce your learning. These questions cover nail structure, growth, diseases, disorders, and conditions. Answering them helps you consolidate your understanding and prepares you for real-world application. Continue to check your understanding with additional questions. These help you identify areas where you may need more study and ensure you're confident in your knowledge of nail health and care. Use these checks as a tool for ongoing improvement. As we approach the end of the lesson, final knowledge review questions help you validate your learning. These questions ensure you're ready to apply your skills in nail care and client service. Take time to answer thoughtfully and use your responses to guide future study. Validate your learning by celebrating what you've achieved in this lesson. Recognizing your progress helps build confidence and encourages ongoing growth in nail care expertise. Take pride in your new knowledge and look forward to applying it in practice. Let's recap the key points from today's lesson. We covered the structure and growth of the nail, recognized various diseases, disorders, and conditions, and discussed how to modify services based on client needs. This knowledge is essential for providing safe, effective, and personalized nail care. Now that you've learned about nail structure, growth, and health, it's time to apply your knowledge in practice. Use your skills to evaluate nails, recognize issues, and provide safe and effective services. Remember to refer clients to physicians when necessary and always prioritize their health and well-being. Continuing education is vital for staying updated on nail health and care. Keep learning about new developments, treatments, and best practices. This commitment ensures you provide the highest quality service and maintain professional standards in nail care. As we conclude this lesson, remember that nail health is a reflection of overall well-being. Providing knowledgeable, attentive care helps clients maintain healthy nails and feel confident. Stay committed to learning and improving your skills and always strive for excellence in nail care.